A cleft lip and palate is an abnormal gap or split in the upper lip and roof of the mouth that extends all the way up to the nostrils. Being most prominent during the first trimester of infancy growth, this irregularity essentially occurs when the bones of the hard plate and the tissues of the lip fail to intersect and join towards the middle of the mouth. Because the lip and palate mature independently, a baby can be solely born with a cleft lip, a cleft palate, or a combination of both. The majority of clefts to the lip and palate tend to be isolated. However, the clefts of the palate can be unilateral, clefts that occur on only one side, or bilateral, clefts that affect both sides of the mouth. Whilst this deformity can have very severe implications to an individual's everyday lifestyle, speech pathologists and plastic surgeons can help repair or simply assist those who are battling with this abnormality. In terms of implications to everyday life, a cleft lip and palate has a significant impact on communication. Particularly, people find it extremely difficult to produce sounds which contain the consonants P, T, B, T, D, SH, or CH. This is primarily the case as the soft palate which separates the oral cavity and nasal cavity is disordered. Henceforth, the individual cannot push sounds through their oral cavity as they ordinarily would. As well as an alteration in sounds, a cleft lip and palate can negatively impact a person's voice quality. They will often have a degree of hypernasality, which basically means that it is perceived by others that the person appears to be talking through their noses.
The cleft lip palate is a condition that occurs at birth as it is caused by the baby's mouth parts not joining up during early fetal development. In Australia, the cleft lip palate condition was reported in 2002 to 2003 to be the 10th most frequently reported birth abnormality. The approximate statistic is that in Australia, 1 in every 700 babies will be affected by cleft lip or cleft palate. The cause of cleft lip palate is currently unknown. However, various factors, including certain genetic factors and environmental influences, are believed to increase the chances of a baby being born with the condition. It is estimated that approximately 1 in 3 babies that are born with cleft lip palate are likely to have a relative with a similar chromosomal or genetic condition, or the same condition. The cleft condition often is genetically inherited and runs in the family. A parent who is born with the condition has a chance of passing it to their children. As recently reported by the Centers for Disease Control and Prevention, it was found that some key environmental factors that increases the chance of a woman having a baby with cleft lip palate were maternal smoking, the use of certain medicines to treat epilepsy such as valproic acid, and women that had been diagnosed with diabetes. Other factors that can also contribute to increased chances of the development of cleft lip palate condition in a baby are maternal diet, maternal hypertension, and maternal alcohol use. A 2003 collaborative study comprising of more than 7.5 million births was conducted as part of the International Perinatal Database of Typical Orofacial Clefts funded by the National Institutes for Dental and Craniofacial Research and delivered through the Human Genetics Program of the World Health Organization. This study found that the prevalence of the cleft lip and palate was 9.92 births per 10,000 births, with the cleft lip accounting for 3.28 births per 10,000 and the cleft palate 6.64 births per 10,000. Stone A similarly conveys in his 2014 article, Cleft Lip and Palate, Etiology, Epidemiology, Prevention and Intervention Strategies, that the incidence of the cleft lip and palate is approximately 1.5 per 1,000 live births, accounting for 250,000 new cases per year worldwide.
Taking two contrasting lived experiences of cleft lip and palate, it is evident that the living environment, education, and socio-economic status play a large role in shaping the way in which communication disorders are approached and treated. The case studies of Fred and Carrie both have cleft lip and palate, however their lived experiences vastly differ. Carrie lives in suburban United States and therefore was born into a technological advanced and medically focused society. On the other hand, Fred lives in rural Mukono, Uganda, and consequently lacks the access to many of the services Carrie has relied on heavily throughout her experience.
Although there are a very limited number of similarities, it can be said that both Fred and Carrie received some form of surgical intervention to treat their cleft lip and palate, just in differing degrees.
Carrie and Fred had loving and supportive parents who gave them emotional support and became primary carers. Some of the differences include socioeconomic status. Fred lived in poverty. His mother and father had unstable income as a Maisie Market seller and a construction worker, respectively. 2 of their 5 children lived with their mother's sisters as they were unable to care for all of them financially. Fred was only able to receive medical attention due to the charity CBM, Christian Blind Mission. It's a miracle that he survived infancy. He was unable to drink breast milk and had very little access to other nutrition. His mother dripped cow's milk and mashed bananas for hours on end. Another difference is the living conditions. Fred lives in rural Uganda, meaning that there is a lack of understanding and education about cleft lip and palate. Many of his community believed that he was cursed and threw sticks and stones at him. And another difference is of education. He was unable to go to school due to children bullying him as well as his difficulty forming words.
Unlike Fred, Carrie was born into the higher socio-economic status of an American city and therefore had much greater access to healthcare and surgery. Her family did not have to rely upon charities to fund her surgeries, and she had her first corrective surgery in infancy to ensure she was able to feed properly. In contrast to Fred's 1 surgery, Carrie underwent 10 surgeries in total, with the final surgeries such as nose and jaw surgery focusing more on the cosmetic aspect of her condition, a luxury Fred did not have. This greater access to medical care and technology also meant that Carrie's cleft lip and palate was discovered before birth, with her family therefore being prepared and educated for the challenges she would face. Education is another key difference between the lived experiences of Fred and Carrie, both of themselves and of those around them. As Fred lives in rural Uganda, his village has little experience with cleft lip and palate and no opportunity to access information, whereas Carrie's internet access allows her the means to educate both herself and her family. The internet also acts as a means of networking for Carrie, as she has a YouTube channel where she shares her story and connects with others who are experiencing similar conditions. This means she does not feel as isolated as Fred would in his rural village. Despite Carrie's cleft lip and palate, she was able to attend school as a regular child, with her birth defect not limiting her in terms of education. In doing so, she was able to form a group of good friends and therefore an additional support network that Fred was unable to develop. She also was subjected to a very limited amount of bullying, and although she acknowledges her lack of self-confidence at points, ultimately celebrates her uniqueness. This is placed in direct contrast with the way in which Fred would have sticks and stones thrown at him. Lastly, Carrie's care was performed by a coordinated team of speech pathologists, doctors, nurses, dentists, ear, nose and throat specialists, and a range of other professionals over an extended period of time. However, Fred's care was mostly limited to the surgery, with a limited amount of care prior to and following this surgery. Ultimately, although cleft lip and palate is not a generally well-known condition, it can have a large impact on the life of affected individuals. The way in which it shapes one's lifestyle is essentially dependent on a number of social determinants, including socioeconomic status, education, and living environment, with the experience of cleft lip and palate in Africa differing greatly to that in America. This disparity in experiences is significant for both health professionals and parents of cleft lip and palate children, as it highlights the notion that not all patients face the same challenges or have the same opportunities, and therefore each individual should be treated specifically to their needs. Similarly, those with cleft lip and palate should be reminded to not compare themselves with others, as fundamentally we are all unique.